Hello viewers, this is Dr. T.V Suresh working as a consultant at Srikara Hospital, Kompally. Now we are discussing about shoulder instability. Okay, so shoulder instability and dislocation of the shoulder. Okay, so usually we will see this condition in young people. Most of the times we will see in young people only. Young people, young and active people will see this condition. Okay, so most common type of dislocation what we will see in the shoulder is anterior dislocation of the shoulder. Okay, so after dislocation of shoulder, patient usually comes to our casualty with severe pain and unable to do the shoulder movements. So we will assess the patient condition after coming to casualty, whether the pain was there or not, and we will see clinically examine whether it was dislocated or not. So the contour of the shoulder will not be there. Usually it will be there, and in this condition of shoulder dislocation, we will not see the contour of the shoulder. Okay, so after that we will advise an X-ray. Usually we will see in X-ray like dislocation of the shoulder anteriorly. So along with that dislocation, at some times we will see any fracture along with that shoulder dislocation. Okay, so we will assess after X-ray whether only shoulder dislocation is there or other associated with the fracture. So after assessment, we will give an anesthesia, we will assess the condition, and then after anesthesia we will reduce the dislocated shoulder. So after usually patients for first or second times we will see the patients, and after we will give for a splint for 3 weeks or 3 to 6 weeks. After 3 to 6 weeks, usually we will advise shoulder strengthening exercise by a physiotherapist. So mostly it will be relieved by that time. And in some patients what we will see is recurrent dislocation of shoulder. So in recurrent dislocation of shoulder, what will be there? So the shoulder will be dislocated by more than 3 times. So usually some patients will be there like they will relocate themselves after dislocation. So the tissues which is there over the shoulder will be in a lax condition. Okay, so after we will assess the condition of the patient. Usually if the swelling was not there, usually we will advise an MRI to undergo. So patient usually come with their MRI scans, and we will see whether problem is there or not. So usually in MRIs we will see labral tears will be there. So mostly it is called as a Banker's lesion. Okay, so after assessing the patient condition, usually we will advise repair of the labrum which is there. It is called as a Banker's repair. It is also will be done through a shoulder scopy. So after passing scopes, we will assess whether only labral tear is there, and along with that any other things like supraspinatus and other tears, other ligament tears are also there. Okay, so after that we will see depends on the injury or depends on the nature and depends on the area of injury. Usually it will be relieved by some 2 suture anchors. Okay, so we will pass 2 anchors, and along with that sutures will be there. We will tie those things, and that will be repaired off. So depends on the area, we will apply 2 or 3. Mostly it will be relieved off. Okay, after that one we will see, we will advise physiotherapy for usually in a week wise manner, like for first week it will be like 30 degrees, second week 60 degrees, third week 90 degrees, like that. After that, after third week we will allow them to go active movements of the shoulder. Okay, so that they can move their shoulder and they can do their activities. Usually 95 to 99%, mostly it will not dislocate again mostly. Okay, so thank you.